Welcome to Fit and Chips Chats. This is a podcast for women over 40 who are looking for sane and frank advice about their health and wellness, especially through menopause. I'm Amanda Thebe, the original resilient bitch and menopause guru. In my work as a personal trainer and nutrition coach, and through my own personal experience, it became obvious to me information about menopause and this curious phase of our life was so ridiculously hard to find. And that's why I started this podcast. Join me every week as I speak to health and wellness experts on hot topics that directly impact you. I've made it my mission to help you by exploding a few myths, presenting you with the facts, and hoping to inspire you to be a healthy, strong person just like me. If you like this show, please subscribe and leave a review. Then go and tell your friends, and then go and tell your husband, and then tell the neighbor. And then don't forget to visit me at fitandchips.com. And now let's get started on today's show. During this year, I read a book called Estrogen Matters. It was co-authored by Dr. Avrum Bluming and Dr. Tavris. The headline of the book is Why Taking Hormones in Menopause Can Improve Women's Well-Being and Lengthen Their Lives Without Raising the Risk of Breast Cancer, which seems quite a controversial title. The book is anything other than that, though. The book is one of those books that I think every woman should read. It really just helps weed out all of the misinformation that's out there, the bad information that's completely confusing to lots of women out there. Dr. Avrum Bluming has spent his life working in oncology, and for more than 2 decades, he's been studying the benefits and risks of hormone replacement therapy administered to women with a history of breast cancer. Dr. Tavris, I love this woman, by the way. You just wait till she gets talking. She's so sassy. It's the best. Received her PhD in social psychology from the University of Michigan, and her work is amazing. And she's won awards for her efforts to help promote gender equality, science, and skepticism. In fact, she's written another book called Mistakes Were Made, But Not By Me. I had them both on the show recently, and we talk about the book. We talk about Estrogen Matters. We talk about why hormone replacement therapy should be first-line treatment for most women through menopause and post-menopause, about the benefits of taking it, about those women where there are risks involved. I think this is a really great show, and hopefully it will help ease some fears and some concerns that you may have around the matter. It might be that you listen to the show and at the end of it, you just decide that estrogen and hormone replacement therapy isn't for you, but at least you've weighed up the risks versus the benefits. And I think that you'll really take a lot away from this show. In addition to this, go buy the book. The book's brilliant. It's literally changing the way we look at hormone replacement therapy, and then give it to your doctor if you're struggling to get any help in that department. And without much further ado, I'd like to welcome both of my guests to the show. Welcome to the show, Avrum and Carol. Thank you very much for coming on today.
Well, we are delighted.
Absolutely.
So let's just get into the meat and bones of this. Can you tell us, please, what historically happened with HRT, and then what's the truth behind the WHI 2002 report, please?
Sure. Estrogen was promoted in the 1960s to keep women young forever. And that was unfair and dishonest. And there was a book written called Feminine Forever by a gynecologist that was widely circulated, and many people used estrogen and felt better on it. But from the 1960s until the early 70s, it was used widely. And in the 70s, it was found that estrogen alone could increase the risk of uterine cancer significantly. And so usage dropped. We then found that progesterone, if given together with estrogen, will eliminate the increased risk of uterine cancer, and use of estrogen increased. And the terminology refers to hormone replacement therapy, which is generally used to mean both estrogen and progesterone for women who have a uterus, and for women who don't have a uterus, it means estrogen alone. We usually use HRT or hormone replacement therapy when we're talking about the combination. In 1991, estrogen was found to increase survival, decrease the risk of heart disease, obviously treat menopausal symptoms, and an editorial in 1991 in the New England Journal of Medicine by Lee Goldman, who was a professor at Harvard and who's now the dean of Columbia Vagelos College of Physicians and Surgeons, wrote that it's time women were given estrogen. In fact, the editorial was named Time for Decision, Time for Action, Not Debate. And estrogen was widely used. And then in 2002, primarily, there was a very large study called the Women's Health Initiative, published in July of 2002, that erroneously stated that estrogen or the combination increases the risk of breast cancer, heart disease, Alzheimer's disease, and the usage of hormone replacement therapy dropped precipitously around the world by 75%.
That's pretty significant then, 75%. So all of these women all of a sudden stopped being protected.
And well, their physicians stopped giving them estrogen in a desire to protect them from the conclusions that were widely publicized around the world.
Okay.
And let me add a bit of history here. Prior to 2002, Robert Wilson's Feminine Forever was a patronizing, awful book arguing that women need to take estrogen in order to be cute and perky and pretty and sexy and adorable for their husbands, and that they should be feminine forever. He was in the pocket of the pharmaceutical industry, as it was eventually revealed. And so many women's health activists, in opposing that condescending notion, also associated it with estrogen being somehow a villain too. And throughout the 1990s, critiques of the pharmaceutical industry and its false advertising and the argument that we need to be medicated for every normal problem and passage in life, those critiques were building also. So by 2002, there was a kind of double whammy. There was this flawed study of the Women's Health Initiative, but also arguments from women's health activists that women really didn't need hormones and shouldn't need hormones, and that it was somehow unfeminist to suggest that women take estrogen.
It's a really fascinating viewpoint that I hadn't heard or considered until I read the book. And I just was, and I understand where that comes from as well, because that is really patronizing to say, we need to be like youthful and perky forever. I mean, it goes against most women's beliefs now. We're tired of being told that, right? But to tie it in with hormone replacement therapy, I didn't actually understand the connection. So it's quite fascinating.
Well, it is. I mean, it's one of the things that Avrum and I emphasize in the book is not that estrogen will make a woman feminine forever, but healthier longer. And that is a very important difference.
Yeah, very much so. And actually, I was going to just add later on through the conversation, though. But yes, I think that, like, for myself personally, and for many of the people who are in my community, we often only associated HRT with something you could take for the symptomatic side of perimenopause, menopause. There was never a conversation that we have heard in sort of our generation that has said it's not just for that. Like, there's actually so many benefits that you essentially should be thinking of taking it all the time just for longevity. And so I think that I would love the whole conversation, like you said, to change around why women need HRT.
Sure. First, 7 times as many women will die of heart disease in the Western world as die of breast cancer. And estrogen decreases the incidence of significant heart disease by up to 50%, which is why Lee Goldman wrote that editorial in 1991. He's a cardiologist. And when we say that, people say, sure, but it's older women who die of heart disease and younger women who die of breast cancer. But in fact, in every decade of a woman's life, her risk of dying of heart disease is greater than her risk of dying of breast cancer, and that difference increases as a woman ages. And as I mentioned, estrogen can decrease the risk of significant heart disease by 50%. The leading cause of death among women diagnosed with breast cancer is heart disease. And that's not surprising, since breast cancer diagnosed at an appropriate time is now curable in about 90% of cases. In addition, as many women die, certainly in this country, and I believe in England as well, of complications related to hip fracture due to osteoporosis as die of breast cancer. And estrogen decreases the risk of osteoporotic hip fracture by 50 to 60%. And we explain in the book how that works. It really helps improve the tensile strength of bone. Calcium and vitamin D, which women are told to take postmenopausally, does not prevent hip fracture. For every woman diagnosed with breast cancer, which currently runs a 90% cure rate, 2 women will be diagnosed with Alzheimer's disease, and there is currently no treatment for Alzheimer's disease. Depending upon which study you read, estrogen can decrease the risk of Alzheimer's disease by between 25 and 60%.
It's pretty significant. And I remember reading you saying about the number of women that will die of complications through hip fracture has been about 40,000 in the US, but that is in older women, whereas the number of breast cancer being about the same is for all women. Is that correct? Did I understand that?
That is correct.
So it's crazy. The numbers are crazy. That actually shocked me and sent me to the gym to do some more. Well, can we go back to the study though, just quickly, because I'd really like women who are listening to this and their husbands and everybody else to understand, how the report was flawed. Like, what were essentially the misconceptions that came out of the report?
Well, we go into that in detail in the book. When Carol talks about it, her voice has a better sense of outrage than mine. So, Carol, why don't you talk about that?
Outrage? Why? Me? Why? Whatever do you mean? Well, Amanda, Avrum and I are both scientists. And so we believe in the importance of scientifically sound research on which to base important health decisions that we make. So if someone says, eating scraped banana peel will increase your survival rate by 400%, I want to know about the banana peel, and I want to know how the study was done, and I want to know if it came out to be what we call in science a statistically significant finding rather than something that could just be a fluke. So in science, there are many conventions in terms of how we decide whether a finding is a strong one, a meaningful one, a trivial one, an accidental one, or a spurious one. When we looked at the Women's Health Initiative's statistics in which they claimed that taking HRT increases the risk of breast cancer, something that so many millions of women are frightened of, we were appalled to realize that finding was not statistically strong or significant. It was less significant than being, say, a left-handed Finnish flight attendant who eats a grapefruit every day. We try to put this in perspective in our book because the finding was just so not there. And yet, on the basis of this not finding, the study was stopped and women went off hormones. So we are at pains to show what was wrong with that major big study.
Yeah.
We also look for coherence in science. A scientific finding should be reproducible. In fact, the way science should be done is you develop a hypothesis and then you do everything you can to destroy or negate the hypothesis. And only if you're unable to do that are you allowed to say, this may really be a finding. And what we find is exactly the opposite approach done by the people who participated in the Women's Health Initiative. And these are highly respected investigators. They do everything they can to confirm their obvious bias that hormones are bad.
Exactly right. Exactly right. That's the key thing, Amanda, which is they clearly went into this with some agenda to show that hormones, particularly estrogen, is harmful. The lead investigator of the Women's Health Initiative had published an article 5 years before the Women's Health Initiative calling for an end to the HRT bandwagon. It's gone too far, he said. Really? And this is the guy we put in charge of determining whether estrogen is harmful.
And one of the simple messages that he delivers is that estrogen causes breast cancer. Well, actually, it doesn't. Estrogen, even in the Women's Health Initiative, estrogen alone, given to women without a uterus so they didn't get progesterone, estrogen alone did not increase the risk of breast cancer. And in fact, in one of their follow-up reports, they found a 30% decreased risk of breast cancer among women who were randomized in that study to estrogen. But if you look at what we know about estrogen, first, people argue that the more estrogen you're exposed to during your life, the higher your risk of breast cancer. And we attack that in the book.
Yes.
Pregnancy before the age of 20 reduces the lifetime risk of breast cancer by 75%. Women who give birth to many children and therefore have their body flooded with estrogen on several occasions have a lower lifetime risk of breast cancer than women who are never pregnant. Pregnancy after breast cancer does not increase the risk of recurrence. And in one study, it's been associated with a decreased recurrence of breast cancer. And so what these authors say, although many people still believe that estrogen causes breast cancer, is, well, it's not estrogen, it's the combination of estrogen and progesterone. And I can go into details of helping to exonerate progesterone, but I'm going to take a break and let Carol say something.
It's okay. And Carol, as well, when you talk, I wondered if you would also include and try and help me understand why we're so fixated on the idea that HRT causes breast cancer when people like you and many others are trying to change the narrative.
Mm-hmm. Mm-hmm. So I'm sorry, why we are fixated on?
Yeah, like it's almost women still to this day. I mean, you must get 1,000 emails a week like I do. And women still say, I'm not going to take HRT because I'm scared about getting breast cancer still. It doesn't matter how many times we've tried to allay those fears. Why does that happen?
Well, because fear is one of the most motivating emotions that we have, isn't it? And so if we're afraid of breast cancer, because all around us we are exposed to that idea, and so few women hear the statistic that Avrum just said, that 90% of all new cases of breast cancer, women with breast cancer will be cured. I mean, this is extraordinary, and an extraordinary change from the days when women thought of breast cancer diagnosis was a death sentence, which it no longer is, right? Okay, so we have fear of breast cancer in particular. And so what women seek to alleviate that fear is something that allows them to feel in control of their bodies in a way that will prevent them from getting breast cancer. So now I hear all around me that estrogen causes breast cancer. What can I do to control both my fear and getting breast cancer? Not take estrogen. Unfortunately, what that leads many women to do, because they know that estrogen in some form is really what makes them feel better and to be healthier as well, is that they seek pseudo-estrogen-like alternatives, which are sometimes simply not as effective or are just placebos. So I want to say this with immense sympathy for women. Avrum was talking about osteoporosis and heart disease and Alzheimer's and so forth, all extremely serious concerns for women's health. But let's not overlook the plain old rotten symptoms of menopause itself throughout a woman's 40s and 50s. I was fortunate. I didn't have menopausal symptoms. And so it was easy for me to say, oh, well, they're just bothersome. So what if you can't sleep? And so what if you have hot flushes? And, so what if you have insomnia for a while? Which is the attitude, by the way, of many women's health activists who think, just suck it up, ladies. You got through the onset of menstruation, you can get through menopause. Just, get a fan, as one woman said to me, just get some fans. Well, that's fine if you don't have significant symptoms. But we now know that years of suffering from insomnia and sleeplessness and heart palpitations and depression and joint pain and muscle aches, these take a health toll on women throughout their 50s. They're not trivial symptoms for those women who suffer from them. And so I'm sympathetic to women. What can I do to alleviate those symptoms, preserve my health, that won't give me breast cancer?
Carol spoke to a lady who was diagnosed with breast cancer and was blaming herself for taking estrogen. And Carol, being a compassionate person, wanted to put her mind at ease. Why don't you continue, Carol?
Well, yes, I said, gee, good news for you, in effect. Taking HRT did not cause your breast cancer. Isn't that good news? You can stop beating yourself up. And she said, no. Don't you get it? She said, I want to believe that hormones cause my breast cancer because that gives me control now. Now, by stopping the hormones, I can make sure I don't get a recurrence.
And women also want answers, right? They want to know why it happened to them, right? They're looking for a tangible reason, right?
Yes, this woman actually said with a smile to me, she said, I'm sitting in the doctor's office and wondering how many women there for treatment for breast cancer had taken hormones. And then she said, you know what? All of us had coffee that morning too. She's not going to blame the coffee, but she can blame the hormones.
And women are told that the symptoms that Carol was referring to will last about 2 years. Actually, the median duration is 7.5 years, and in some women, it's more than 10 years. And there is nothing like estrogen that can help control or eliminate those symptoms in up to 85% of women.
By the way, my hand's in the air because that's me. Exactly, right? And I'm just like so many other women out there. And so what do we know? I know this is a big, big conversation, and I just want you to touch on it a little bit. What do we know about breast cancer and HRT, as in, some women do have estrogen positive breast cancer, and I'm talking out of my bumhole here. I have no idea what I'm saying. And so can you talk about that a little bit, Avrum, and try and explain, or at least clarify what that means to have a breast cancer that has some type of estrogen impact?
Even though we don't understand what causes breast cancer, we look for clues that help us treat it most efficiently. And one of the big developments is that we can analyze the molecular components of breast cancer, and we've identified what is called an estrogen receptor, which is sitting on the membrane of breast cancer cells. And we know from trial and error experience that women who have estrogen receptor positive breast cancer respond to hormonal manipulation, which means if we give them tamoxifen, or if we take out their ovaries, or if we give them another agent that seems to inactivate the estrogen receptor, these cancers will diminish or go away on this treatment. And the first type of medicine, tamoxifen, was called an estrogen antagonist or an estrogen blocker. And the assumption there was, well, estrogen stimulates breast cancer to develop, and therefore these women must stay away from estrogen. Turns out that's not true. In fact, estrogen can be used to treat breast cancer, both high dose and even low dose estrogen And when it was compared to tamoxifen, it was just as effective as tamoxifen. It's just there are other symptoms associated with giving high-dose estrogen, which is the first way it was done, and tamoxifen was therefore used in its place. To think that because a woman has an estrogen receptor positive tumor means she must never take estrogen has simply not been borne out by studies that have been done over the last 15 years.
See, Amanda, this is what is so fascinating in the connection between how we understand science and how we live our lives. The overriding belief that estrogen is carcinogenic is what has driven research and treatment and general beliefs and how women behave and so forth. And Avrum, in taking on that basic widespread belief by so many physicians as well as by women and men, of course, it's like overturning a belief in, I would say, Santa Claus, but we do outgrow Santa Claus.
No, we don't.
No, maybe we don't. Maybe we don't. But here's another one.
But I understand. Yeah.
You see what I mean? I mean, it's like it's taking on a national belief. It's similarly, we see this, for example, in nutrition, where attacking the idea that eating fat is what makes us fat. That was a common belief for 40 years and led to all these low-fat diets and so forth, which did nothing to reduce the obesity rate. And it wasn't true, okay? But go try to argue with the fat is bad for you establishment. That, in effect, is what Avrum and I are trying to do here in this book, is to say the underlying belief that estrogen causes cancer is what's wrong.
So interestingly, as the researchers in the Women Health Initiative have pulled back from saying estrogen causes breast cancer because their own data do not show that, they have said, well, it's not really estrogen, it's progesterone. And by the way, the combination of estrogen and progesterone when given to women who still have a uterus is what we found, they say, increased the risk of breast cancer development by 26%. Well, in fact, when you look at their data, first, the 26% increased risk, which amounted to going from 5 women in 1,000 to 6 women in 1,000, wasn't really significant by statistical testing, and it also disappeared over time. So that follow-up studies performed in 2006 from these same investigators found there was no longer any increased incidence among these women who had been randomized to estrogen and progesterone. But that never made headlines.
No, it didn't, did it? It's back to the fear again, right?
Back to the fear. And one other important thing, just a couple of years ago, Joanne Manson, one of the investigators, said, well, now, even though we still think that HRT increases the risk of breast cancer, that is balanced out by estrogen's benefits for osteoporosis, heart disease, and so forth. What she neglected to say, balanced out, is not balanced out. Their own data showed that women on HRT after many, many years were living longer than women not on HRT.
By the way, progesterone also has been used successfully to treat breast cancer. And women who have chronic progesterone deficiency do not have a decreased incidence of breast cancer. With chronic progesterone deficiency, they have an increased incidence of breast cancer. And studies looking at progesterone given around the time of surgery reported on 1,000 women found that a single injection of progesterone has improved the overall prognosis of these women compared to women who were randomized not to receive the injection. And the 26% that was not statistically significant was studied in detail by Phil Sorrell at Yale and Howard Hodis at USC, who reported that when you compared the group of women who got the combination of estrogen and progesterone with the women who got the combination, that got estrogen alone, there was no increased risk among the women who got the estrogen progesterone compared to the women who got estrogen alone. And yet the Women's Health Initiative found no increased risk with progesterone alone. And so if you look more carefully, you see that the problem wasn't the combination. The problem was the control group to which the women getting the combination was compared. And that control group had a decreased risk of breast cancer. Why? That control group included women who had been taking hormones before they were randomized to placebo in that study, and they had a decreased risk of breast cancer.
That's crazy. And you see, these type of facts are just not getting shared out. And I know
at all.
At all. And I obviously know that the book touches on these, but just in the wider scheme of things, just as a headline grabber, you know, it's just not happening. And I feel like you must be just spinning your head going crazy saying, why don't you understand? I'm telling you, it's fine. But, you know, here's one of the other things that happens in conversations that I have in my sort of like network is that women are really confused about if they've already had the buy-in, I'm going to take out HRT. It's what my quality of life is terrible. I really need something to help me, and I'm okay with going on HRT. There's so many. It's the terminology for one is just it's a minefield down here in the US, especially. It's a big hot mess, and I wondered if you could talk a little bit about that, just to try and just clarify, like what compounded bioidentical hormones are, what regulated are. And I know that this is probably very basic for you, but a lot of women, a lot of us are very confused and still don't understand.
Sure. First, the hormone that's been studied most often, the form of estrogen that has over 60 years of study and data associated with it, is Premarin, which is an acronym for pregnant mare urine. It doesn't smell, but that was one of the earliest forms of estrogen that was used. And that appears, with a thorough review of the medical literature, to be the most effective in preventing Alzheimer's and heart disease and not causing breast cancer. The drug company that makes it, Eli Lilly, charges an unacceptably high amount for it, and we don't support that at all. But from a scientific standpoint, that appears to be the safest. There are people who are selling other forms of estrogen that, instead of being taken from mare urine, they're taken from yams, and that contains largely estradiol. Estradiol is the form of estrogen that is the most concentrated, the highest concentration of estrogen in a normal adult female body. And that is marketed, and I underline the word marketed, as bioidentical. Bioidentical is not a scientific term, it's a marketing term because it is so appealing. It's kind of like natural. And bioidentical hormones, when they are manufactured appropriately and regulated by the Food and Drug Administration, the FDA here in this country, are also very effective in dealing with the conditions we've spoken about: osteoporosis, heart disease. I believe Premarin is most effective in preventing Alzheimer's, but that is the subject of continued discussion. And we have no problem with those bioidentical hormones. And hormones can be given in a variety of ways. They can be given orally, like Premarin is given, or they can be given by patch. And there are data showing that when it is administered through the skin by patch, there is a lower risk of clot development, especially in veins. The risk is very small, even with the pill, but it is lower or even absent when it's given by the patch. We have no problem with any of these preparations.
As long as they're regulated.
The problem we have is when you talk about compounded bioidentical hormones, you are entering another variable. And the variable is that it is made up by individual pharmacies and is devoid of FDA regulation. So that the dose within the pill or the patch, the absorption, the hormone levels are not predictable. And we object to that. There are problems with compounded bioidentical hormones because you're giving a drug that you can't predict for certain has particular components. The only time compounding appears to be acceptable according to every organized regulatory body we know of is if somebody is allergic to a compound or a substance within the approved formulations, it might be necessary to make a specific compounded preparation for that patient, like with a peanut allergy, but that is a minority of these women.
I want to underscore, Amanda, Avrum's use of the word marketing. With all of the fear about HRT and estrogen, when that all erupted, when that blew up, women were left, you said the word, confused, and that's exactly right. As prescriptions for Premarin and established versions of estrogen plummeted, what was left was a vacuum for women to determine what they would be able to take that felt to them safe or natural as well as beneficial. And when you have a vacuum between what women need and want and what can be provided for them, that is an opportunity for so many bogus marketers to rush right in and offer solutions. And so I think what we're seeing in the landscape of treatments for women with menopausal symptoms and who are looking for something to take over the longer haul, what we see is all of these promotional places, boutique services for women in menopause. We will tailor your treatment, to you. We will offer you all kinds of alternative supplements and vitamins and
hormonal balancing.
Hormonal balancing, a peculiar term indeed, as if you could balance a hormone. And hormones fluctuate; that's their nature. So there are all of these marketing gimmicks. I really want to use that word that women really need to be thinking about critically and carefully before they sign on to them. In their fear of hormones, in their reluctance to take Premarin itself, there's a temptation to go to these alternatives, which sadly, but reliably have been shown to be no better than placebos, not beneficial in the ways that estrogen itself has been amply demonstrated to be.
And also very expensive because they're not covered on insurances, especially over here in the US, where it and so I think that I hear stories of women spending thousands and thousands on these, like you say, boutique hotel, boutique hormonal hotels type of thing, right. and they're feeling no better at all, and they're also being administered. I'd like just to quickly ask about this other hormones that I don't know that have been shown to be beneficial. They've been administered DHEA as well within that. Is that something that we have any data on?
There are some data, but very, very little data. And the absence of data allows marketers to make unsubstantiated complaints. Unsubstantiated claims. Exactly right.
Yeah.
And what we tried to do is referenced the book heavily so that everything we say can be investigated and argued with, but we reference it to peer-reviewed medical journals. When we talk about Premarin and micronized progesterone as being the best studied and the safest. We reference why we say that. And it's probably appropriate to mention here that neither Carol nor I are on the payroll of any pharmaceutical company. We are doing this simply because we want to get the word out and for no other reason.
I would say one other thing too, which is that although we do list every reference we've encountered, we examine the occasional study that seems to disconfirm an argument we make. So we examine these things very carefully. We're not just cherry picking the evidence to make our case, but we have really tried very hard to make this book readable for general audiences. Yes, there are plenty of references for physicians who want to know what studies we're talking about, but each chapter ends in plain old English. What are the alternatives you could take if you are at high risk of osteoporosis, you are at high risk of heart disease? What are the alternatives? Should you be taking calcium? Should you be doing puzzles for your brain? And we go through each alternative that have been promoted and let you know what the evidence shows for us.
It's a very easy book to read. And I feel like it's also more of a reference book. I'll think of something and go, oh, I'm going to check that up. It's a go back to book, I think, don't you? It's like
Thank you, Amanda. Yes, that's the goal.
And the other issue is, are we two strange outliers in Southern California who are simply starting a new religion? And the answer to that is, well, look at the people who are endorsing the book. Vince DeVita, who is the former director of the National Cancer Institute here in the United States. Michael Baum, who's one of the leading breast cancer investigators in the world, based in England, who's also probably the most honored breast cancer investigator in the world. Jerry Kassira, the former editor-in-chief of the New England Journal of Medicine. Robert Cialdini, who wrote a wonderful book about persuasion. Phyllis Greenberger, who's a woman's advocate dealing with scientific issues. It's important to look at the context of the people who read and have approved this book.
So because of that, then, this is a really good segue. Thank you for that, Avrum. But so here's the most persistent thing that I hear is that I'm going to my doctors, I'm informed, I've read the book, I've read the studies, I've looked at North American Menopause Society's stance. I know that my first line treatment for this should be HRT, and that's what I'm going to ask for. So women will go to their primary caregivers or GPs. Actually, I won't talk about the UK because I feel as though they're getting a process in place, but especially here in Canada and America, they're going to their doctors and the doctors are telling them they can't have it. Their doctors are refusing because they're not current. They're not up to date on, the latest findings. I mean, how do we jump over that hurdle? Because that's very frustrating for women to actually want something and then be refused.
Mm-hmm. Well, the North American Medical Association is setting up an international reference network. Isn't that right, Avrum?
The Menopause Society.
Menopause Society, I'm sorry, yeah.
Yes, and there's also Genève, which is founded by a woman who actually was a Microsoft marketer who helped bring the Xbox into existence. Who is trying to set up an international resource network for women.
Yep. And well, doctors are not forbidden for prescribing this, but many of them, physicians are so busy, they can't keep up with every study, with every change in medical practice and so forth. But I think when women go to their physicians and say, look, there is evidence for the benefits of this regimen and I want it, if the doctor won't even consider this, the woman might need to find another doctor because there are many who are changing their minds about this.
Many women are giving the book to their physicians, and it takes time to get into this. This is not an M&M where we think everybody should take it and there are no downsides. This requires a conversation and a careful analysis of benefit and risk, and that takes time. And your physician must be willing to put in the time both to inform him or herself and to discuss it with you.
It happened to me on a personal level where my doctor, first of all, didn't want to give me it until I persisted. Thank goodness I have got persistence. Mm-hmm. And then he would only give me estrogen only. I remember telling you this, Avrum, refusing to give me progesterone. And I was furious. I left the office and went to somebody else. But then he emailed me later and said, you were right, I was wrong. I'm actually sorry, and I'm going to change my practice. So I just think that that was like my small victory in the young doctor. And I understand that, like you talk about this in the book, that statistically, our primary caregivers may have had no menopause training at all. This is just void from their education, and that's a challenging thing for a woman to have to deal with, right, when she's going to the doctor.
Mm-hmm, mm-hmm. It says they have also very little education in sexuality. They're reluctant to ask women about it, talk to women about it, something that's very important for many women. And, and let's not go there, right?
But the fact that less than 25% of OBGYN fellowships actually teach menopause management is a disgrace.
Yeah. Mm-hmm. And can anything be done about that? I mean, is the conversation changing in that organization?
We're trying to make as much beautiful noise about that as we can.
As possible, yeah. I actually, when anybody asks me, I just get women to just print reams and reams of information off and just say, this is what I want. And I feel confident in my knowledge and my body that I want this. And I think that that's a very hard thing for women to advocate for themselves historically in the medical field, right?
Mm-hmm. It is, the first book I wrote was called The Longest War. And there have been many skirmishes and many battles that women have won by organizing and focusing on what it is that they want for their own rights and their own health. And we have seen, starting with our bodies ourselves in the 1970s, when women said, you know what, we demand that the medical establishment pay attention to us. The normal body is not the male body. There are female bodies, and they are not identical to male bodies. No. And we have specific issues and needs that the medical establishment needs to pay attention to. And they had many, many successes. The medical profession understands that you no longer can use the male body as the norm. Organizing.
I think progress has been made for sure. If you look historically over, I think this is just one of those steps that we still need to overcome. But honestly, books like this are just really helping women. And I had I reached out to my private Facebook group and I said, do you have any questions? And we've reviewed a bunch of them, and a whole lot weren't questions. They were comments. They were like, will you please just give them a big virtual hug and tell them that you've actually opened my mind and actually allowed me to sort of take on this data, because I already had this preconceived notion that I couldn't take it. And so you're helping people, and it's an amazing thing that you've both done. So I'd like to thank you for that.
Well, thank you, I must say, for raising this with these women, and for your support and your enthusiasm. It just means the world to us.
And for doing your homework and helping to lead this charge, Amanda. Thank you so much.
Thank you. And thank you both very much for coming on the show, and just keep up the good work. Charge forward.
All of us.
All of us. Thank you.
Take care.
Goodbye. Thank you for listening to the show. And now I have a quick favor to ask of you. Would you leave me a review? Every time you leave me a review, it helps me get in front of new listeners. It helps me to continue to put out great content and get fabulous guests on the show. And in return for you doing that, I will send you a free gift. I have a 12-week core focus program called Abs on Fire. All you need to do is 2 simple things. 1, leave me a review on iTunes or Google. 2, email me at amanda@fitandchips.com and I'll wing that program over to you. Thanks so much, guys. The views and advice expressed in this show by myself are not a substitute for conventional medical service. No information here should be interpreted as a medical diagnosis, treatment, or prevention of any disease. If in any doubt, always contact your healthcare provider. Thanks so much for stopping by. Take care. Bye.